Good afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin. Joining me today is Dr. Unika Scott, the Maternal and Child Health Officer. Welcome, Dr. Scott.
Thank you so much, Alicia. This social distancing show is being quite effective in this period. I think we can really work from home and not being in contact with each other, and it's just as productive.
Yes, definitely. So, today we're going to talk about Vaccination Week, observed yearly in the month of April. Dr. Scott, could you tell us what is Vaccination Week in America?
Well, actually, Alicia, officially, vaccination week in 2020 began from April 25th to May 2nd. Unofficially, because of the pandemic, vaccination week has been extended in most of the Latin American countries to extend beyond the 2nd of May. So we're still in vaccination week activities in Guyana, joining the rest of our Caribbean brothers and sisters. Some people have extended theirs until the 13th or the 15th of May. But to answer your original question, this is the 18th vaccination week of Latin American and Caribbean territories. And basically, um, it's a week that we take to honor our immunization heroes. It's a week that has the objectives of raising awareness about the importance of immunization across the life cycle, all ages. Growing up, vaccines were just for children, but no, because of their efficacy and the fact that they have been proven to save lives, there are vaccines for every stage, actually. And diseases happen at every stage of life, and whether or not we deem it a public health miracle, there are vaccines that address those diseases at every stage. Um, Additional objectives noteworthy to mention is that during vaccination week, we use the opportunity to promote vaccines as one of the most effective cost intervention. They're not so expensive, and it's also an opportunity to build on the immunization programs progress and the needs and to fill some of the gaps. Like in Guyana, historically during vaccination week, we look at those children who have dropped out. We look at catching up. We look at leaving no child behind, because if it is that one child, maybe in the interior or a remote location, has not received a particular antigen, then we're exposing them to diseases of a preventable cause. And you know what those diseases are: measles, yellow fever, diphtheria, which incidentally our neighbors, both Venezuela and Brazil, are battling currently outbreaks in their own context in those countries. And because they are our neighbors, we still run a risk of having an imported case. Hence why, although we're in COVID-19, it is important to understand why we must stop and realize that immunization is an essential service, one that the ministry will not permit to be interrupted altogether.
What is Guyana doing in observation of Vaccination Week this year?
That's an interesting question. We've shared over the last week through social media and other media sources some of the activities. Of course, there'll be no mass vaccination week campaigns like we're accustomed to. Usually, every region will have a massive march to raise awareness. There'll be debating competitions. There will be school vaccine competitions, school vaccination campaigns as well. This year, none of that will happen. Routine vaccination will be ongoing. Of course, um, we're encouraging appointments, we're encouraging physical and social distancing at the clinics. No clinic should be full to capacity in the waiting room. Spaces will be marked. There'll be all the precautions taken by the healthcare workers to have respiratory hygiene to the highest maintained, as well as surface hygiene. In a few of the regions, almost all of them, except for Region 4, because we did the national launch, but there'll be televised launches, radio programs that's scheduled for Region 1, Region 7. Um, they have been reports of smaller outreaches because there are a few villages that we can still reach in the hinterland locations that offer challenges when, as it relates to meeting those children who have, for some reason or the other, dropped out. So there'll be heavy focus on ensuring that the children under 5 years old are covered, that adolescents who would have needed their vaccines, their tetanus, their HPV vaccines, also are given the chance to receive either the first or second dose. Um, that adults who need their vaccines, the yellow fever vaccines, their measles vaccines, depending on the border location. Especially Region 7. Region 7 has been doing quite a lot of work, even leading up to vaccination week, going to some of the most remote locations and offering the service there with all the precautions taken to prevent COVID-19.
Dr. Scott.
It is a packed program. After the conclusion of the celebrations, we usually receive a report, and then we see how many antigens, how many persons were reached, how many antigens were administered. We review some of our challenges, and it's going to be interesting this year to look at what sacrifices were made. And there's something about vaccination week that we always want to pay attention to, or pay homage to, and that's the sacrifices of the healthcare workers. I
Yes.
remember hearing a story of a village in Region 9 called Simoni, where the healthcare workers would literally have to cross the river. Were interesting stories that came to us. I want to particularly mention the one village in Region 9, I think it's called Simoni, where healthcare workers would have to traverse a very perilous river. And by perilous, I mean there were these very flattened canoes that they would use, and they would cross this river that was filled with caimans. I think it still is. There would be a threat because these caimans are very aggressive
Yeah.
with their vaccination flask and all the gears, and have sticks to ward off caimans as they traverse going to the area to give vaccines. And although they tell it so fearlessly, you can't help but shudder. And another village that usually has me amazed with the sacrifices the healthcare workers um, undertake, and this I've witnessed myself, is Plateau in Region 9, going up very slippery slopes, ATVs, the all-terrain vehicles with vaccine flask on their back just to go to a population, maybe of 5 children, 4 children, to give vaccines. And these are efforts that have continued despite the challenges of weather, terrain, access. Healthcare workers in in some of our regions work 6, 8 hours just to collect their monthly supplies so that they can meet the needs of their population. And it's because of these efforts, they lead up to the big picture of still having Guyana and its borders safe of vaccine preventable diseases. And why we want to remember too how important it is not to not to segue or to let our guard down when it comes to protecting Guyana, even in the pandemic, is because in the 2014-2015 epidemic of Ebola, the World Health Organization released data that showed that the deaths resulting from HIV, TB, measles, and yellow fever in that part of the world were far more in quantity than the deaths that resulted from Ebola. That's because health systems are overwhelmed because they were at the time dealing with Ebola, so you didn't have lots of emphasis being placed on the already existing threats. And we don't want that to happen to Guyana. We know that because of our neighbors, because of um, the outbreaks of yellow fever that we've had and of measles we've had in our surrounding territories, we still need to be vigilant not to let any of those diseases on our shores. And that's why we are going to proceed very cautiously, but it's not a baton that we're going to let down altogether.
Thank you, Dr. Scott. For those persons who are watching the program right now and are wondering is, what is being done for vaccination week, I have a question for you to answer. How important are vaccines during this COVID-19 pandemic? Because I know with all that's happening now, persons may not want to go out and all that. So how important is vaccines at this time?
Well, it's to reiterate what I said earlier. We want to ensure that we don't allow the diseases of a preventable cause to take lives,
Yes.
that we don't allow the healthcare system to be overwhelmed by an increase in cases that we have not seen in our shores for quite some time now. We haven't seen measles since 1991. We haven't seen polio since 1961. We have not had a case of yellow fever in over 33 years. And so we want to keep those at bay. Um, there have been efforts being made to contact families, to contact mothers and daddies, to let them know when they should bring their children to the clinic so that we don't have large groups. We have been encouraging our healthcare workers. So from time to time, we're admonishing you to answer the phone if you see a strange number calling, because it's probably one of the neighborhood community healthcare workers or somebody from your clinic calling to reschedule your child for vaccination, or imploring you not to forget to get your own vaccines, or if you're an adult. But it is very important. Right now, we're working towards, and this is the world over, towards a vaccine to prevent COVID-19 infections. And this has caused some amount of light, greater light, to be shed on the importance of vaccines altogether in preventing diseases. And there is some trust in vaccines. There's trust in the public health system. There's also shared interest in groups that have been anti-vaccine before, because now we're realizing that in order to protect our loved ones, we see the power and the strength in using a vaccine. So yes, it's not a service that we want to have interrupted at all at this time.
What are some of those concerns that parents are expressing at this time about vaccination during COVID-19?
We've gotten interesting feedbacks from across the country. They want to know that the clinics are safe, that there are good screening mechanisms in place, that there's good hygiene mechanism in place, that the healthcare workers are protected, and that they themselves are protected if they visit the clinic, that they would not have large crowds. And to the best of the reports that we have been getting, to the best of the supervision that we have been giving on the ground, this is not an issue of worry. In some of the coastland areas, we're still seeing that people are rushing to the clinic, but they're met um, with some amount of hesitation from the nurses, because if we're observing social and physical distancing, then we cannot have large groups. So when they would turn up and we've passed their quota, then advice would be given for them to either be rescheduled or to wait in an open area where they're separated from the rest of the persons that are waiting there. And more, the general populace is using the telephone of the health facility to make contact whenever possible with the facility so that they can be given their appointed time for services. And it doesn't include vaccinations alone, it includes other maternal and child health services as well as family planning. So we're seeing some amount of awareness that the public themselves is ensuring that the healthcare workers as well as those who access the clinics are kept safe.
Great. So, can we say that our health workers, they are using their protective gears and so forth as they should and so?
Most definitely, the orientations that are given in all the regions. It's hard sometimes not to for a healthcare worker not to have physical contact, especially if you're given a vaccine. Physical contact is needed. But good respiratory hygiene, nonetheless, is something that is certain on the ground at our clinics. There is no sense of insecurity at all. And I believe that the feedback in both the coastline and the hinterland regions have all been positive to date.
Thank you, Dr. Scott. For those persons who have just joined the program, what can persons look forward to even after COVID-19 stops in regards to vaccination services?
The same and even better. Like I said before, there is a greater awareness with all the talk of the COVID-19 vaccine and all the possibilities. The US trying to get a vaccine in less than 1 year, the World Health Organization presently having 4 trials out. Um, there is going to be a greater emphasis placed on um, health literacy for persons at home. There's a lot of reading happening in at homes now. Parents have more time to do research. They have more time to pick up the phone and ask their healthcare workers quite endearing questions, and we want to encourage some of those because that is how you actually get people to support the program and interventions that work. But another thing that the ministry is looking to do is to protect those of the elderly or aged population. So maybe in June we hope to have the PCV23 vaccines given to persons with chronic diseases, persons with immune compromise, and those are going to be people over the age of 19 and way to the elderly population to offer added protection for pneumonia or lung distress causes actually. That has been something that has been in the pipeline before. Early in February 2019, we did have a campaign and those vaccines went very quickly because there is need. But we've also been having lots of calls coming to the office asking for PCV23 vaccines. And I think this is from the news that our population is getting from the outer world that the influenza and PCV vaccines are being distributed. It will help to uh, a greater extent, and I'm happy to see the demand is there because, as you well know, Alicia, our health literacy in Ghana needs to improve.
Yes. Thank you so much, Dr. Scott, for joining me on the program today. It's quite informative. I want to encourage you to keep up the good work that you guys are doing there, the maternal and child development ministry of health.
Thank you so very much, Alicia. And don't forget that we do need to honor those vaccination heroes out there.
Yes.
13 districts, and we have 13 supervisors who, along with their other staff, have been keeping Guyana safe for a number of years.
Definitely, we must honor those healthcare workers. Thank you once again, Dr. Scott, for joining us.
And have a very good afternoon.
This is where we say goodbye for now on Health 360. Until next time, goodbye.